thought you were going to say. Okay,
I'll just trim it.
Miss Sparkles had an order for a Foley catherization. So I'm making sure that she has no limitations, that it's going to be obviously the right patient. I'm going to obtain all of my stuff that I need for this demonstration, and I've already cleaned the area. I already did perineal care, so that's been taken care of. I don't need assistance with her either. She can help me herself, so we don't need an assistant. So I'm gonna gather all my stuff to take to the room with me. Entering the room, I'm gonna go ahead and close the door to provide privacy and perform hand hygiene. I'm gonna introduce myself. I'm Mercedes, Miss Sparkles. I'll be your nurse today. May I please have your name and date of birth? Perfect, that matches. We have the right client. I'm going to explain the procedure to her on what we're going to be doing. So first, I am going to go ahead and raise the head of your bed. Raise the bed. And then I'm going to get her in the position before I open all my stuff, so it's ready to go. I'm going to go ahead and pull up your covers, okay? Is that okay with you? Okay, perfect. So we'll go ahead and do this. Just exposing the area we need, to make them feel comfortable. And I'm gonna go ahead and put a towel down just for extra absorbency. We don't want her sheets getting wet or anything like that. So you can wrap them around where you're not gonna touch anything. This one is a smaller towel because mine is smaller, and you would just shove them up and just pull it right out. I'm gonna go ahead and perform hand hygiene again before I open my package. I'm gonna check the packaging, make sure it's intact. There was an expiration on the outside. I've opened this several times, so I don't know what I did with that. But check that, and we're gonna pull it out. Discard that. I wanna make sure you open away and the sides first, and then towards your body. And we're going to don our sterile gloves. Open these up and I'm gonna make sure that you don't touch the 1-inch barrier around it. So I'm gonna glove my dominant hand first by using my forefinger and thumb, and I'm going to pull it straight up so we don't touch any of that non-sterile area. You want to make sure you're only touching the inside of the glove, and to do the next one, you'll use 2 fingers to scoop. Again, you want to be aware of any situations in your thumb. So I'm going to pull straight up just to get that on there. After they're on, if you had any mess ups, you could then touch everything because it's sterile. Go ahead and trash that. That probably wasn't accurate. I'm going to go ahead and drape her. Put a drape underneath her again for any leakage or anything like that. Again, wrap it. And I want to make my sterile field as large as possible. So I'm going to have that one. I'm going to go ahead and take my blue one and just make it longer. So I have plenty of workspace to catheterize her, but make sure you have enough fold over so nothing pops up. Then you can go ahead and move everything into your sterile field. At this point, you want to get everything ready. So I'm going to put my iodine on all of my cotton balls and then get rid of that. I'm going to open and put the lube in there. Again, I would have a trash can if this was an ideal scenario, and trash that. Go ahead and get my catheter ready. I would take it off, inspect it, just make sure it's all intact. I'm going to go ahead and attach the syringe so it's all ready to go. Do that. And now that you've gotten everything ready, you need to remember your non-dominant hand is going to stay there because it's no longer going to be clean. So I'm going to separate her labias. I'm going to go from anterior to posterior on the left side first and make sure I discard the cotton ball. Again, same thing. I'm going to discard the cotton ball. I don't want to go over my sterile field with those cotton balls because that would contaminate it. Then anterior to posterior right down the middle. Again, discarding what you use. I'm going to keep my hand there. I'm going to go ahead and put lube on my catheter and insert it until there's a flash of urine. So we're going to insert it. Okay, oh, there's a flash of urine. So with my non-dominant hand that's not sterile, I'm going to hold it in place while I do the balloon. Okay, and that's done. Oh, sorry, I forgot to pull it off. It's tricky because it wants to keep on loading it up. Okay, and go ahead and I'm going to have this, go ahead and get that ready so I can do that. I'm going to get rid of all my stuff now and tape it to the side of her leg and take off my nasty hands and attach this. I would take off my gloves and attach it to the side of the bed. I would take off my gloves, perform hand hygiene, and again make her comfortable. I cover her up and lower the bed and have the side rails obviously up before I lower the bed. And now there's been an order for a urine specimen. If you're in the room and don't leave, you could go ahead and take it directly from the bag because that would be clean at that point. So you would go ahead and just take it straight from this bag. If you were gone and she's already urinated, you don't know how many times, that's when you would want to do an indwelling one. And say there's no urine, you want to make sure that you clamp it at the distal portion. So you would clamp it and then you would come back 15-30 minutes later, just enough time that there's a urine in there. You would then have, again, hand hygiene. I would scrub the port with an alcohol wipe. I don't want to have a needle to demonstrate this one at home, but you can also have an interlocking system. This one is a needle one, but once I have that urine, I would go ahead and insert it in the port to obtain the amount necessary. So we'll act like scrub this. I'm going to go ahead and attach it. I'm going to get the correct amount I need, which is typically anywhere from some are 3 to 5 to 10 milliliters of a urine specimen. I can't even talk. I want to make sure that the urine doesn't touch the outside of the container or anything like that. I would then put it into my container, discard if it was a needle in the sharps container or wherever your facility says. Make sure again, no urine on the outside or on the seal when you're closing it. I would name, date this, put the time, any information that they want. This one wants the name, date, time, and instructions, room number, and then I could personally take this down to the lab or whatever the facility deems me to do. Okay. Again, now it is time to take out the catheter. Again, I would have performed hand hygiene, explained to Ms. Sparkles what we were doing, don gloves. I want to check the bag, and I'm going to document again. And I did forget that there is documentation in every step that you do. After inserting it, you're going to document when it was done, time, and for how long if necessary. And again, documentation when you get the samples. And now I would come in, I would explain to her that we are taking out her catheter. I'm going to look at any urine that's left in here, document what I find, how much, color, odor. Go ahead and empty that. And then I am going to tell her, I would have a paper towel for when I take this out. And untape it from her leg prior to doing that. We want to try to limit any wetness or getting on her for skin integrity purposes. And so I would tell her again, I would raise the bed, put down the side rail, only expose what's necessary, and let her know what I'm going to be doing first. And so first, obviously, you want to make sure the balloon is undone. And so this is spring load, so it's just going to take it on out of there. Always pull back a little bit, make sure it gets all out as you're disconnecting it. And now you're going to have her bear down. She's doing this. Slowly, and once you get it out, you want to inspect it, make sure it's all intact, because that could cause major problems for her. So we're going to get rid of this, discard it how your facility says best or how they want you to. I'm going to get rid of the towel, let her get her all comfortable, make sure she's comfortable, lower the put the side of the rail up, lower the bed, and then document what I did, and perform hand hygiene, then document what I did, and have her call light and everything here, and just let her know, make sure she's comfortable and have it all ready to go for her. And that's it.